Beauty scientists Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Some of the newer emerging technologies, one of them is in regenerative medicine, fat grafting and stem cells. So as a quick background to our listeners, fat grafting is just sucking up fat and then, placing it back in. So fat harvested liposuction, fat grafting, we can fill it a wrinkle, we can actually augment and create volume. The interesting thing is that fat actually has some stem cells, which are technically not fat cells. Stem cells are the great grandfather, great grandmother cells that can turn into skin, cartilage, muscle, whatever, with the correct surroundings, the correct chemistry, the correct chemical hormone messengers. So can you talk a little about how stem cells have helped change your practice, as well as some of the controversies behind it?
Yeah, so I love fat transfer, just like a beautiful operation, right? So you and I both do filler. We love filler. There's like a great place for it, but there's nothing better than replacing like with like. So if we're doing facial rejuvenation and we want to add some volume, adding your own fat's perfect. I mean, that's what we've lost slowly as time has gone on. And it comes not just with the hyaluronic, but all this other material, all these growth factors, the stem cells. And so initially it was in reconstructive patients, we really saw the difference. Like we would do fat transfer into irradiated skin, cancer patients that just like they'd had surgery, they'd been irradiated, the tissues were like hard and like leathery. And then after injecting fat in them, we'd find that they became softer. Some of the discoloration went away. And that kind of piqued people's curiosity. Like, hey, something is going on here beyond just plumping the area with fat. And so there's an increasing body of research looking at this. And so we see it when we do fat transfer, the skin looks better. It's not just that we're volumizing and creating nice highlights and softening shadows, but it actually seems to do something to the skin and tissues itself. So I think that's what's really beautiful about it. What's controversial, to me, it's like not so controversial, but it's a stem cell. And so the moment we say stem cell, then everyone gets up in arms and we're not doing experiments on babies and test tubes with this. These are your own stem cells. They're not going to become another person, but therein lies the controversy, right? And there was some concern when you move stem cells, like could it trigger cancer, things like that. We also know that at least like in breast and face, that's not true because a lot of this research was born out of the breast reconstruction literature, which is where we're looking at patients who have already had cancer. So they're higher risk than the average person. And we saw that transferring fat from other parts of the body to the breast in areas where cancer has previously existed is safe and does not increase your risk of breast cancer. So that's really, really important.
Yeah. And then the controversy as well is even if we get your own stem cells, and we know we get it from you, we are in the US only able to wash it in saline, maybe antibiotic irrigation. That's about it. In theory, if you have the right recipe for the stem cells, hey, we can make it into heart cells or cartilage cells or other things like that. That's really not legal in the US. It is legal in certain countries in the world. And that's where some horror stories have happened where some doctor or clinic says, hey, we have a special recipe. We're going to cook it. We're going to give it to your knee. We're going to give it to your spinal cord. We're going to give it to your heart. That's where actually some documented cases of cancer have occurred. That is something that we're still working on in terms of getting the correct recipe for your stem cells so that we can actually grow cells and organs.
But to be clear, that's not what we do when we're doing fat transfer and surgery. Like we are just taking it as it is and putting it back in just as from whence it came. But we're not doing anything as plastic surgeons right now in the US to trigger those stem cells to become something else. So whatever they do it on their own.
That's correct. That's 100% correct. We don't do anything in the US. No way. That's important for the patients out there, and don't mishear us because we're not doing it. We're doing it safely.
Yeah.
So
always safety first.
Yeah.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.